a spray paint.
Huh?
What you spray? That spray
No, I
paint.
didn't. They can't be. I told them.
They can't
no,
spray.
they spraying it on the newspaper on the floor. I told y'all gonna get that on the floor.
That what is it, acrylic or whatever? Yeah.
Well, thanks for joining me today. Today I want to talk to you about Let's Fight Breast Cancer Together with Awareness. If you're aware, that's how you can fight it. Breast cancer is a cancer that starts in the tissues of the breast. There are two main forms of breast cancer. It's ductal carcinoma that starts in the lobes of your breast. That's where they make the milk, so those can be affected with the nipple. Then, that's the most common cancer type. Then your other type is lobular carcinoma, which starts in the parts of the breast that also produces milk, but those are your lubrose ducts. In rare cases, breast cancer can start in other areas of your breast, which could be on the side, under, depending on also if you had breast implants. You become prone to have higher breast cancer. Many breast cancers are sensitive to the hormone estrogen. This means that estrogen causes the breast cancer tumor to grow. Such cancers is called estrogen receptor positive cancer, or ER positive cancer. Men are also prone to get breast cancer. So men can get breast cancer also. Being aware of breast cancer can help save your life. So the causes of breast cancer can be your age and gender. Your risk of developing breast cancer increases as you get older. The majority of advanced breast cancer cases are found in women over the age of 60. Women are 100 times more likely to get breast cancer than a male. Another factor is your family history of breast cancer. You may also have a high risk for breast cancer if you have a close relative in your family who has had breast cancer, uterine, ovarian, or colon cancer. So that's where men come in with the breast cancer from the colon cancer. About 20 to 30% of women with breast cancer have a family history of this illness. Another factor is obesity. Your weight. When you are obese, you usually are prone to get diabetes, high blood pressure, which is hypertension. Those are causes that can lead to cancer, and the cancer we're talking about is breast cancer. The last one that can affect you is menstrual cycle. Women get their periods early if you got your period before the age of 12, or if you get it later after 18, you are more prone to have the gene that carries breast cancer.
Wow.
So you're more increased with the risk of breast cancer if you got your period before or if you got your period after 18.
So it's like
Or-
a little too early or a little too late.
Yes, the normal time that a girl goes through puberty is usually 11 through 13 or 14, depending on where you live in your environment. Those are factors that can help. Symptoms can get worse as breast cancer starts to develop silently. When I say silently, you may have these symptoms for several months and never know. Some of the early breast cancer symptoms that you may not see or notice is the change in the size of your breast. By looking at your breast, they may not look any different to you. So we ask you to feel on them. When you feel on them, you can feel the shape, you can feel the difference in the nipple. For example, you might find redness in those areas. So if you feel on that redness may be a lump or another sign that you need to see a doctor. Puckering or dimpling in your breast, if you start to get a sunk in breast in a certain area, that's a dimple, like the one you smile, you have the dimple in your cheek. Those are also symptoms that you should look at. Another one would be fluid that comes from your nipple. If the fluid is bloody, clear to yellow, green, or looks like pus, and you know you didn't just have a baby and deliver, so you're not breastfeeding, those are signs and symptoms that you need to speak with your doctor about. A breast lump or a lump in the armpit. Some women think that this area right here still does not consist of their breast. This does consist of your breast. So if you get a lump here or there that are uneven or just doesn't feel right, that usually means you need to see a doctor, even if it doesn't hurt when you touch it. Because some people say it doesn't hurt. It's still a reason you should still see a doctor. Men do get breast cancer, and the symptoms include breast lumps, breast pain, and tenderness. That could be in the bone area right here. You can have breast pain on your breast, skin ulcers that you can start to develop, and swelling of one arm next to the one that has breast cancer. So the arm that has, the area that has breast cancer, then this arm would start to swell. Or if you notice weight loss, those are other things. Now let's talk about if you decide to know that you have these symptoms, what do you do now? The next step would be to speak with a doctor or a physician that is trained and tell them about your symptoms and your risk factors, and then he will perform a physical exam which will include both your breast, your armpits, your neck, and your chest area. One of the tests that you can have done, we mainly do these tests for women over 45, which is the mammogram. That is to help identify any breast lumps. Then you can have a breast MRI that will further telegraphically split your exam, where they can go in and see literally how far advanced your cancer has gone. If you're at that stage, they can go and let you know if you're at stage 3 or stage 1 or 2. A breast ultrasound. Just like when you have a baby, you have the regular ultrasound, they will just use it over your breast, and they can see by sound bouncing back and forth if you have any lumps, or they can see if any fluid is being filled in areas that it's not supposed to be. And the last one, you can have a CT scan. That's basically where you run through the machine. It's a magnetic resonating gas. It's very loud and very bothersome if you're claustrophobic. That would be one you wouldn't want. But it's also another way that through these other tests, if they couldn't find something, they can also be able to find something then. Those are usually your last test, is a CT scan. Now, if the doctor decides and comes back and tells you that he thinks that you might have cancer, we have some of the best technology that has risen in the last 20th century for cancer treatments. And treatments is based on many factors. It can include the type, the stage of the cancer, whether the cancer is sensitive to certain hormones, and whether or not the cancer overproduces or overexpresses a gene. That gene that we talked about, the estrogen receptor positive cancer, that one basically be one that they're looking for. In general, they only have a couple cancer treatments. Basically, the first one is chemotherapy. That is medicine that they put into your body to help kill the cancer cells. The third one is radiation therapy, and it's to destroy the cancerous cells. And the last one will be your last result that I would never want anyone to go through, is surgery to remove the cancerous tissue. The first one is the lumpectomy. That is where they remove the breast lump. And the last one is a mastectomy. That is where
they take the whole breast, right?
they take the whole breast, or they may remove half or part.
They look funny with it.
Yes, you usually do. Where they usually kind of don't look normal. A lot of people didn't like that. Other treatments are hormonal therapy to block certain hormones that fuel cancer growth, targeted therapy to interfere with cancer cells growth. Susan B. Cure has stated that 1 in 8 women in America will get diagnosed with cancer. So what we would love for all of us to do is be breast self-examination aware. I provided these little sheets. Basically, they're guidelines that you can do. The first one is know your risk. Know what your risks are in your family. Know your family history. Know what's going on. The second one is get screened. Going to your doctor, getting screened, especially women that did start their periods earlier or later, or they notice some symptoms, or they're over 40. You are needing to get to the doctor to get screened at those
I do
times.
the breast thing, a yearly
Yes, when you go get your yearly pap smear, that's another important one. If you go get your yearly pap smear, that is something the doctor will do for you instantly. Is he will give you a breast self-examination right there on the spot on the table. The third one is know what is normal for you. Knowing what is normal for you, you know that if you have diabetes, should you be eating a bunch of sugar?
No.
Should you be having your high blood pressure go up? No. So if you know what's good for you and best, those are the things that we should do. If we know we shouldn't be smoking because we have cancer, we should stop. And the last, fourth one is make healthy lifestyle choices. When you make healthy lifestyle choices, that is giving you 1,000 days back on your life. You lose 1,000 days when you decide to make the wrong choices by continuing to drink alcohol every day, smoking cigarettes. Those things are risks that will get you breast cancer. That ends our basically that ends my speech on Let's Fight Breast Cancer Together with Awareness. Thank you. Thank you.
You must have to do this for 2 hours.
Yes.
Imagine that's her for her.
Yes.
She was like, oh my God.
I didn't even want to.